I'm saying good morning, everybody. Welcome to Edu Skills OET Made Easy. Our mission is to make you fall in love with OET. Let's love the process of learning. And if you're watching this on YouTube, kindly consider subscribing the channel. Give us a thumbs up if you like our work. And please do share your feedback in the comment space so that we customize upcoming sessions based on your comments. Your needs, your challenges, your mistakes are our syllabus for next session. So make sure that you let us know what you need. And also, please do share to your contacts so that we reach out to many people, especially those who are financially struggling to crack OET. And today we are dealing with listening and listening part A. This is a session on request. Depending on your concerns, we have customized. So this will be a bit advanced session, even if there are beginners. Don't worry. Hope you have seen the videos which were posted in the previous days. If you have seen the videos and wrote down the strategies and practice, definitely you will understand everything today. Otherwise, we'll be helpless. However, the concerns can be addressed during the Q&A session. OET 2.0 Occupational English Test, Listening Part A, Key Skills. And as usually I tell you, and normally there are many concerns coming on this line, and you are being trained from various sources to target at 350. And I tell you, most of you land into the trouble of getting 340, 320, all these 330 because of your target. So always aim at 450. Grade A, at least you are safe on around 400. Exam format, patient-led dialogue. I'm not going to deal with it in detail because I have dealt with it in my previous session. Patient-led dialogue means most of the answers will come from the mouth of the patient, and whatever the health professional speaks will be something like a side heading, which guides you. Listening to them will tell you what is going to be next. For example, is the health professional asking about the symptoms, then one of the symptoms will be the answer. If they're asking about medication, one of those medicines will be the answer. That will be the side heading. So it's almost like a patient-led dialogue. And I tell you, make it a guideline for your speaking role play card as well, where you will be addressing a patient and you have the same questions which you can use there. And this knowledge will definitely help you in practicing your role play card in the speaking subtest as well. And 30 seconds to read the 12 questions before the audio begins with a beep sound. There'll be a beep sound after 30 seconds. That, golden seconds to predict, anticipate, foreseeing, the first method, which I'll tell you later. Maybe I have explained it several times. So these 30 seconds are known to be golden seconds to predict, where you can really predict the answer even without going into the audio or listening to the audio. And you have a challenge here. You are not able to beat the time, which I'll be giving some guidelines how to beat the time. And write the exact word or phrase as given in the audio. That also I'll be dealing in detail. Use the exact word and phrase. Don't change it. Beware of paraphrasing in the question. Synonyms and synonymous language will be used. Those are the common things which I tell you for all the subtests, which is very, very essential. And a couple of the strategies that I taught you. So, typos, okay, minor spelling mistakes, they are okay, but then it should never distort the meaning of the word or meaning in the context, or it should not distort the pronunciation in a major way. So minor typos, maybe when you write better, if you use one T instead of two T, maybe condoned, but then if you write BUTTR, butter, entirely the meaning is different, pronunciation is different. So those will not be, those typos means spelling mistakes, will not be all right. You will be penalized for those things. So beware of the spellings. Meaning and pronunciation should not be distorted when you have a typos or spelling mistake. 3 possible answers, and you are supposed to choose the best answer, not the right answer, the correct answer, or the best answer. There will be better answer, there will be good answer, but you have to choose the best answer among them. Color in the circle to mark your answer, that is known to you. Listening strategies, prediction or anticipation, beware of paraphrasing, beware of synonyms, beware of collective words. This I'm not going to explain now because I have explained in detail in the previous session. If you have any concerns, we'll deal with it during a Q&A session. And what are you listening for? Listening for scale, synonyms, synonymous language, paraphrasing, collective words, that is a repetition, sorry. Collective words, adjective, chronological, or time expressions, contrast, all these things you'll have to listen for. That's cool. Okay. Look at the context, questions 1 to 12. The context is very important. They will introduce the context at the very beginning, and they will speak about a health professional. then you know almost something connected to that particular department or particular specialization, the topic and the audio will speak about. So you have a gastroenterologist talking to a patient named Andrew Trailer is today's context, which you will listen to. For questions 1 to 12, complete the notes with a word or short phrase that you hear, one word or a couple of words. You have 30 golden seconds. I told you 30 seconds to look at the notes. We'll just check if you can hear.
Occupational English test. Sample test 2. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1.
So the topic today is irritable bowel syndrome. You have to use the first method, foreseeing, investigation, reading, speaking out, teleprinting. So foreseeing is very, very important, the prediction part of it. So beware of that, and you should know as soon as you are introduced to a particular condition, you should be able to predict those things. And visualization, I told you the major issue. Like you visualize a situation, for example, irritable bowel syndrome, what do you understand by that? You imagine that a patient is visiting you or coming to you with this particular syndrome or with this particular condition, and what will be his or her situation and what are the expressions they will have. Just try to live that situation. Visualize the whole scenario that you are very familiar with in your health profession. Okay, 3 dominant languages of that your brain can understand. Maybe just the other day when I taught you about 5 dominant languages of nurses. I haven't completed it. I just spoke about one particular language, and the second when I started, it will be continued. But some had a confusion regarding that. Those 5 love languages of nurses are like the language of touch, language of affirmative words, then language of service, language of gift, quality time, then you have service. Okay, so words, touch, time, gift, service. These are the 5 things which I'll be explaining in the next session. That's not very important for OET, but definitely it's important for life. So 3 dominant languages here that your brain can understand. One is visual. Okay, whatever you see or imagine or visualize, your brain will understand better, grasp better. The other one is your audio, like auditory memory, we call it. Auditory memory means you are listening to something. Some people easily capture the listening part, or if you listen to my lecture, you remember better. But then the other day you have seen someone explaining in the session who was that, Jamal saying that I don't remember exactly the words expressing the scale, modal verbs and all, but I just remember those slides, those colorful things exactly. It is in my mind. I can remember, okay, this is this, this is this. So she is a visual learner. Okay, she can just remember by looking at my slides or these colorful things on screen. Whereas some will definitely grasp better by listening to somebody. You listen to something. So audio, when you listen to audio, you are using that particular auditory memory or capacity of your brain, then visual capacity of your brain, and kinesthetic. Kinesthetic in the sense you participate, you do something, you write, you underline, you circle. So you involve in the process. So you should be able to use all these 3 dominant languages. That is essential for practicing. And in the beginning stage, I tell you, don't worry about the score. Definitely, I told you, you can do the test in some conditions, setting your alarm, but then don't worry about the score. Let it be whatever the score. Don't be concerned about the score. Be concerned about developing the competency, and automatically or gradually, without even your realization, the scores will improve. Now let's visualize the signs of irritable bowel syndrome. Could you just tell me some signs, or what do you feel when you have irritable bowel syndrome, or what you can in layman's language, something like acidity, or what is it? What is the other word?
Constipation, diarrhea,
heartburn.
constipation, diarrhea.
Abdominal pain.
Pain.
Abdominal pain.
Burning sensation.
Burning
Okay,
sensation.
burning sensation.
Bloating.
And
Bloating.
yeah, those are the physical things. Any other connection with some other thing? Has it got any psychological aspect?
nausea, vomiting.
Yes.
Anxiety.
Insomnia.
Yeah,
Lack of
anxiety,
sleep.
anxiety or stress. When there is stress, definitely.
Depression.
Yeah, depression. Yes. Yeah. Okay. So that's what I said. You have to psychological abnormalities, motility abnormalities, sensory abnormalities. That's just IBS. Pain. So irritable bowel syndrome. Then about food. Definitely, when you think of your tummy, your belly, your stomach, you think of best and worst foods, right? So what you have to avoid? So these things you have to visualize. Okay, don'ts and do's. Gut feeling. What is good for you? What is not good for you? No, don't go look into the details. So we are going to practice it. Okay, are you ready? Take up some paper and pen, and we'll just listen.
Yes, Father.
Okay,
Yes,
we'll
Father.
just listen. Okay, we'll just listen and try to identify the answers. Now you have. We'll give you 30 seconds. It will be there in the audio itself. Let me check.
Occupational Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1. Questions 1 to 12. You hear a gastroenterologist talking to a patient called Andrew Taylor. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Taylor. Now, you've been referred to me because it's possible that you're suffering from irritable bowel syndrome or a related condition?
Yes, that's right.
Okay, could you start by giving me some background?
This has been going on for many years. After meals, I've always tended to get heartburn, but I found that pretty easy to deal with by taking antacids from the pharmacy. But a year ago, things suddenly got worse, and there were other problems I started to notice. The symptoms vary a lot, and they can be quite hard to describe exactly, but the main problem is bloating.
I see.
I need to tell you about some other things related to my stomach.
Mm-hmm.
Although this isn't something that happens every day, I've been suffering from constipation in the last month. In the past, I've had the opposite problem and would rush to the toilet several times a day.
Mm.
I just never know how I'm going to feel from one day to the next. It's the way the symptoms are so unpredictable that I hate.
Mm.
It's hard to plan my life.
Were there any other symptoms unrelated to your stomach and bowel?
Well, I have a skin condition that can flare up, and I know this could be related to irritable bowel syndrome.
Mm-hmm.
And the odd thing is that I often have migraines more or less at the same time as the stomach discomfort, and these can go on for days. It's strange, and I didn't at first think it was anything to do with my stomach problems.
Have you noticed anything that can intensify the symptoms in any way?
Well, I have a very demanding job as an accountant. I don't know whether this has a bearing on anything, but there's a chance I might lose my job in a reorganization of my department, so that's obviously something that's making me anxious. I don't know what's going to happen.
What's the worst effect the condition has on you?
The problem isn't just that it's nearly always on my mind unless there's some pretty big distraction, but also that it's so draining. What I mean is I often feel that I've got no energy at all. I just want to sit around and do nothing when I get home from work, to be honest. I go to bed tired, but I'm frustrated because I have insomnia much more than I ever did before. I wouldn't say I've been suffering from depression, but a condition like this can make you feel rather down.
Right. And I understand that you've investigated the possibility that your diet's responsible for your condition. Can you tell me about this?
I was told by a nutritionist I saw that people with irritable bowel syndrome often don't eat enough fiber. In my case, I don't feel that's an issue. I've followed the nutritionist's advice about taking more fluids during the day, especially water, and accept that in the past, maybe I didn't do that enough. It's hard to say whether that's made a difference, but possibly it's caused a slight improvement. I'd read that dairy products can make things worse, so I tried cutting them out, but I wasn't convinced it made any difference. I've cut back on caffeine, though not much, actually. I also paid for extensive food allergy tests, but they didn't show anything major, so that's not an area my doctor thought was worth investigating further.
What medications have you tried?
Well, I took something called an antispasmodic, which my GP says helps to relax the muscular contractions which move food through the gut. But, to be honest, I don't think it made much difference in my case.
Have you taken anything else?
Well, I've been given antidepressants, and I'm giving them a go. I wasn't sure I completely understood the reasons.
Okay, well, a drug like that targets the signals being sent to and from the nerves in the digestive system. It has a calming effect on the muscles there. Do you find that this drug was effective?
Yes, I'd say it was on the whole.
Okay, now just write down. We are not going to tell you the answers now, or we'll visit back after listening to the next one as well. One more we'll listen for your practice, not for the session today. Just listen and write down whatever the answers you can identify. Yes, let's listen. Let me start. Hope it will.
Extract 2, questions 13 to 24. You hear a hospital neurologist talking to a new patient called Kathy Tanner. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Tanner. Pleased to meet you.
Hello.
Do you mind if we start off by getting some background to your condition? Just in your own words, could you talk me through the reason you're here and how it all started?
Oh, please call me Kathy.
Right.
So, until 2 years ago, my husband was in the army.
Right.
We lived off base, and I had a job which involved a lot of driving. Whenever I was in the car, I noticed that my neck would get pretty stiff at times.
Right.
It was hard to turn my head. To cut a long story short, when my husband left the army, we moved to a new house. My neck pain was still a problem, so I decided to visit an osteopath.
Right.
He tried to fix the problem by a neck adjustment, but actually it just made things worse.
Oh, dear.
I found I was losing flexibility in my neck. I began to use a heat pad, which did help at first.
Good, but so not for long?
No. About a month or two on, I started to get this sort of feeling that something was pulling my head over towards my right shoulder.
Right.
It was painful and embarrassing because I couldn't keep my head straight.
Of course.
I'd managed to hide it from everyone around me until then. About this time, one of the doctors I'd seen thought physiotherapy might help and sent me to a nearby clinic. So I started going in regularly for treatments. And one day, the head of the clinic looked at me while the therapist was trying to position my neck and whatever. And he said, "You know what your problem is, don't you?" And I replied that I didn't. And he told me that I had spasmodic torticollis, and I had no idea what that was.
So what happened then?
So he says, oh, it's untreatable. You just have to learn to live with it. I went home in pain, feeling depressed and hopeless.
Yes, of course.
He was just so unsympathetic and unhelpful.
Well, I'm sorry to hear this.
Thanks. So my diagnosis of spasmodic torticollis was in June. So I began to research, what I could do. I tried chiropractic treatment until December. It cost a fortune, but did no good.
Oh dear.
The pulling and pain continued to increase. I saw a couple of neurologists and I was put on a drug called baclofen, but it really didn't make any difference.
Yes, that wouldn't do much for your condition.
Oh, right. Anyway, the one really good thing I did at that time was to join a support group for spasmodic torticollis patients, so at least I knew I wasn't alone with the condition. But mostly, I just sat at home a lot. In order to get a bit of pain relief, I got myself an orthopaedic chair, and that did give me some support.
Right.
In November, I saw something in a magazine in the medical section. It mentioned some new treatments being done at the university hospital to treat things like spasmodic torticollis with Botox. We mentioned this to our GP, got a referral, and in December, I had the first injection in my neck.
And how did the treatment go?
Well, the injections really helped the pain, My head returned to almost a normal position.
Right.
It did give me a few problems, like problems swallowing, but that was okay. I thought I'd received a miracle cure. I was devastated when everything started to come back like before, and I went back to the hospital in May. At this time, the results weren't quite as good. Even though they'd upped the dosages, I ended up having 9 lots of injections, plus the, various oral medications. So I can't remember what they were.
No, it doesn't matter.
But nothing really made much difference. I just got more and more confused, and loss of memory became a problem too. Just for pain relief, they ended up giving me a pump so I could give myself morphine. Finally, I saw something in my ST support group's magazine about a relatively new type of surgery being done by a local neurologist, and that would be you. So here I am.
And we will do our best to help you. Now, just a few more questions.
Okay, can you hear me?
Yes, Father.
Yes, Father.
Yes. Okay. Now, one concern was that you are not able to read the whole thing. Now, first of all, in the 30 seconds golden minutes, what you have to read is side headings, I must say, in the question booklet. You have side headings you have seen, right? What are the dark headings given there? For example, here extract 1, you have background, effects of condition on everyday life, diet, all those things. So those are known as the side headings. So the answers will be connected to that. As I said, if you are speaking about the symptoms, one of the symptoms will be the answer. If you are asking about medication, medicine will be the answer. If you are asking about diet, one of the things concerned with the diet, one particular diet will be the answer. So you should be first looking at the side headings. Okay. Second extract, you had patient background to condition, 13 to 14 questions. Further development in condition and diagnosis, 15 and 16 questions. Treatment history from home, 17 to 19, 18, 19 questions, 17, 18, 19. And from treatment from university hospital, 20 to 24, 5 questions. So that was the side heading what you can speak. So it looks like this, okay? See, almost there is a sequence for everything. You can see in the extract 1, you have patient background, effects of condition on everyday life, diet. Here you have patient background to condition, further developments, then treatment from home and university. So you have to be able to just visualize a sequence in your mind. And from there, you can predict what will be the answer. So you see there is a structure or sequence, as I tell you always. The irritable bowel syndrome, symptoms, going on for many years, a year ago, last month. Symptoms are divided into different chronological expressions. The first says many years, then says a year ago, then says last month. Definitely that will lead you to the answer. The chronological expressions, I said, always is a particular thing where you can locate the answer or which will guide you to the answer. And you see symptoms, unrelated symptoms, the negative expression being used. So there they will definitely tell you the side heading is unrelated symptoms. So they will definitely speaking about symptoms which are related and unrelated. So you should be able to distinguish between related symptoms and unrelated symptoms. Okay. And triggering factors, what intensifies? The question was what intensifies your experience or this irritable bowel syndrome. So here there is a spelling mistake, B-O-W-E-L, it should be, sorry for it. Yeah, typos. And effect on your life. Next thing is effect on your life, then diet, then medication. You can see the side headings exactly developing in this way. Each question is about these things, about the symptoms, then related and unrelated symptoms, triggering factors, effect on your life, diet, medication. So when it comes to diet, I said one of the things that you eat, consume should be the answer. Medication, one of the medications that you take, symptoms, one of the symptoms, unrelated symptom, triggering factors, what adds up or intensifies your problem. Now you see in the question and audio or the script, you can just check out patient, Andrew Tyler, background. This gastroenterologist asks, okay, could you start by giving me some background? That is the question. What is the background? Background should be definitely his experience with this irritable bowel syndrome. Then if there is 1 to 5 questions, 5 questions are answered in that particular background portion where Andrew Tyler describes about what you call the symptoms, various symptoms. And by the way, this is the material taken from official OET website. Thank you, OET, for allowing me to use this particular material for teaching the students. And effects of condition of everyday life. Background. Next one is effects of condition on everyday life. How does it affect your daily life? So 6, 7, 8, 3 questions are there. And the question is, what is the worst effect the condition has on you? The worst. You have a comparison or a scale here. And that leads to answer. And diet speaks about 9, 10, 11 questions are about diet. And the question is, and I understand that you have investigated the possibility that your diet is responsible for your condition. Can you tell me about this? About this means about your diet. So the question, 3 questions about diet. Medication. The question is, what medications have you tried? So when you listen to that particular question from the health professional, you should be able to predict one medication is going to be answered. Just listen to that particular medication. That's why I said you should know what is to listen for. You can't listen for everything. And most of things are not relevant for you. So focused listening is the skill that you need to develop. And by the meantime, I told you the 7 steps. Try to follow those 7 steps because you require multiple skills in your listening test. For example, you have to listen. At the same time, you have to read the question booklet. At the same time, you have to mark your answer. So listening, reading, writing, all 3 tasks, multitasking happens here. So you should train yourself for that. Otherwise, whatever you understand, however you understand, when you are in the examination settings, you listen and read and write. You get confused or stressed out. So practice as per the system given. I have given you day 1 to day 6 practice with mentor sessions, and those videos are uploaded in the YouTube channel, EduSkills YouTube channel, and all the links of previous sessions and the platform link is given below in the description. Please watch those videos and practice according to that particular guidelines in each video that is uploaded. Those are the videos of the previous sessions. Okay, structure, background, history of condition, symptoms. Okay, going on for many years, a year ago, last month. Unrelated symptoms, triggers, now effect on your life, diet, and medication. Now you are going to listen again with this schema in your mind. Okay, this outline in your mind. Try to fill the gaps, fill these boxes with your answers as you listen to. Okay, this is the structure of the thing. Listen carefully. We'll be listening only one part, first extract, and try to, maybe you already have written down the answers, still try to write down the answers so that you practice, as you listen, you practice reading the screen, what is given in the screen, at the same time writing. So we are practicing multitasking.
Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. Extract 1, questions 1 to 12. You hear a gastroenterologist talking to a patient called Andrew Taylor. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Just read what is on the screen and try to follow that structure as you listen to the audio.
Good morning, Mr. Taylor. Now, you've been referred to me because it's possible that you're suffering from irritable bowel syndrome or a related condition?
Yes, that's right.
Okay, could you start by giving me some background?
This has been going on for many years. After meals, I've always tended to get heartburn, but I found that pretty easy to deal with by taking antacids from the pharmacy. But a year ago, things suddenly got worse, and there were other problems I started to notice. The symptoms vary a lot, and they can be quite hard to describe exactly, but the main problem is bloating.
I see.
I need to tell you about some other things related to my stomach.
Mm-hmm.
Although this isn't something that happens every day, I've been suffering from constipation in the last month. In the past, I've had the opposite problem and would rush to the toilet several times a day.
Mm.
I just never know how I'm going to feel from one day to the next. It's the way the symptoms are so unpredictable that I hate.
Mm.
It's hard to plan my life.
Were there any other symptoms unrelated to your stomach and bowel?
Well, I have a skin condition that can flare up, and I know this could be related to irritable bowel syndrome.
Mm-hmm.
And the odd thing is that I often have migraines more or less at the same time as the stomach discomfort, and these can go on for days. It's strange, and I didn't at first think it was anything to do with my stomach problems.
Have you noticed anything that can intensify the symptoms in any way?
Well, I have a very demanding job as an accountant. I don't know whether this has a bearing on anything, but there's a chance I might lose my job in a reorganization of my department, so that's obviously something that's making me anxious. I don't know what's going to happen.
What's the worst effect the condition has on you?
The problem isn't just that it's nearly always on my mind unless there's some pretty big distraction, but also that it's so draining. What I mean is, I often feel that I've got no energy at all. I just want to sit around and do nothing when I get home from work, to be honest. I go to bed tired, but I'm frustrated because I have insomnia much more than I ever did before. I wouldn't say I've been suffering from depression, but a condition like this can make you feel rather down.
Right. And I understand that you've investigated the possibility that your diet's responsible for your condition. Can you tell me about this?
I was told by a nutritionist I saw that people with irritable bowel syndrome often don't eat enough fiber. In my case, I don't feel that's an issue. I've followed the nutritionist's advice about taking more fluids during the day, especially water, and accept that in the past, maybe I didn't do that enough. It's hard to say whether that's made a difference, but possibly it's caused a slight improvement.
Uh-huh.
I'd read that dairy products can make things worse, so I tried cutting them out, but I wasn't convinced it made any difference. I've cut back on caffeine, though not much, actually. I also paid for extensive food allergy tests, but they didn't show anything major, so that's not an area my doctor thought was worth investigating further.
What medications have you tried?
Well, I took something called an antispasmodic, which my GP says helps to relax the muscular contractions which move food through the gut. but to be honest, I don't think it made much difference in my case.
Have you taken anything else?
Well, I've been given antidepressants, and I'm giving them a go. I wasn't sure I completely understood the reasons.
Okay, well, a drug like that targets the signals being sent to and from the nerves in the digestive system. It has a calming effect on the muscles there.
Mm-hmm.
Do you find that this drug was effective?
Yes, I'd say it was on the whole.
Now, hope you got some answers. Like, this is how you have to practice. Maybe you did not even look at the question sometimes, like after your conditions, like once you have completed your listening in exam conditions. Next, you try these hide headings and try to predict the answers, like take the script and try to analyze. Maybe all will not be the answers, but some of them will be the answers. So you can definitely relate. And as you go into the next, we'll see just the options what you can give. Going on for many years, heartburn. A year ago, bloating. Last month, constipation. This is what I said. The chronological order or the sequence will definitely help you to locate the answer. These three are the first three answers. And going to the answer, they say, going on for many years, what is it? A year ago, what is it? Last month, what is it? So exactly the chronological expressions will guide you to the answer. And you have to listen to those chronological expressions. While reading, you have to read those chronological expressions. When you write, you have to write those chronological expressions. When you speak, you have to use those chronological expressions in your speaking subtests. So for all the modules, strategies are useful. And unrelated symptoms. It's not related symptoms. First part was about related symptoms, and that was migraines and triggers, anything that intensify the symptoms. That was job, the work, the word used synonym is work there. I'm not going to go into details because I have explained all those things in the previous session, even regarding how you have to read the word before and after the blank gap or the dash that is given to predict the answers. All those things were basics were explained. Job was demanding and uncertainty creates anxiety and effects on your life, draining, no energy. Okay, diet, fiber, and dairy products. Now you see your problem. One challenge, one particular concern that you raised was your spelling problem. Now this is dairy, and I have seen many of you writing diary here. D-A-I-R-Y. Dairy is something connected with your Milma and milk. Whereas D-I-A-R-Y, diary, is the book that you write your daily story. So if the I comes before A, the whole meaning will be distorted. That's what I said. That will be penalized. Dairy and diary. You can write down. Dairy means milk products. D-A-I-R-Y. Diary, D-I-A-R-Y, is the book that in which you write your daily reports. Hope it is clear for you. So fiber, dairy products, may not be both answers, but then those are the things you have to focus on. Medication, antidepressants. So we are going to listen once again with that background. Okay, sequence and side heading background, you know, background, effects of condition on everyday life, diet, medication. So listen carefully now and write down, and also look into those things. Most recently, there is a scale. Frequent, there is a scale. And word used to describe symptoms. They speak something about speaking about symptoms. He speaks something. Then frequent, again there is a scale here. That's what I said. Everywhere there is a scale leading through the answer, and a synonym, maybe a synonym is used in your question. And here work, and in the question you have job or something like that, or in the question you have work. In the audio you have job. And situation at work means patient's condition. Complaints of lack of, something is lacking, something is not there. He says drained, as noticed. And diet, claims to be consuming sufficient something. No, he says I am consuming sufficient. And hydrated, the word used there, synonym is water, fluids. All those are the synonyms. Experimented with excluding, giving up something. Okay, I have cut down on certain food segments. So whatever. Very slight reduction, has undergone dash, no indications, anything problematic, has undergone something. Okay, has taken an anti-spasmodic note, everything, not trying, now trying dash. Now what is he trying? So again, you have time expression here now. Okay, shall we listen once again, one more time? Are you ready?
Yes, Father.
Yes, Father.
Yeah.
Yes, Father.
Yeah, this time you'll be listening for all the scale and what you call other things like chronology and whatever you can understand. Write down, scribble everything on your notebook, okay? As you listen to. Yes.
Occupational. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a gastroenterologist talking to a patient called Andrew Taylor. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Taylor. Now, you've been referred to me because it's possible that you're suffering from irritable bowel syndrome or a related condition?
Yes, that's right.
Okay, could you start by giving me some background?
This has been going on for many years. After meals, I've always tended to get heartburn, but I found that pretty easy to deal with by taking antacids from the pharmacy. But a year ago, things suddenly got worse, and there were other problems I started to notice. The symptoms vary a lot, and they can be quite hard to describe exactly, but the main problem is bloating.
I see.
I need to tell you about some other things related to my stomach.
Mm-hmm.
Although this isn't something that happens every day, I've been suffering from constipation in the last month. In the past, I've had the opposite problem and would rush to the toilet several times a day.
Mm.
I just never know how I'm going to feel from one day to the next. It's the way the symptoms are so unpredictable that I hate.
Mm.
It's hard to plan my life.
Were there any other symptoms unrelated to your stomach and bowel?
Well, I have a skin condition that can flare up, and I know this could be related to irritable bowel syndrome.
Mm-hmm.
And the odd thing is that I often have migraines more or less at the same time as the stomach discomfort, and these can go on for days. It's strange, and I didn't at first think it was anything to do with my stomach problems.
Have you noticed anything that can intensify the symptoms in any way?
Well, I have a very demanding job as an accountant. I don't know whether this has a bearing on anything, but there's a chance I might lose my job in a reorganization of my department, so that's obviously something that's making me anxious. I don't know what's going to happen.
What's the worst effect the condition has on you?
The problem isn't just that it's nearly always on my mind unless there's some pretty big distraction, but also that it's so draining. What I mean is I often feel that I've got no energy at all. I just want to sit around and do nothing when I get home from work, to be honest. I go to bed tired, but I'm frustrated because I have insomnia much more than I ever did before. I wouldn't say I've been suffering from depression, but a condition like this can make you feel rather down.
Right. And I understand that you've investigated the possibility that your diet's responsible for your condition. Can you tell me about this?
I was told by a nutritionist I saw that people with irritable bowel syndrome often don't eat enough fiber. In my case, I don't feel that's an issue. I've followed the nutritionist's advice about taking more fluids during the day, especially water, and accept that in the past, maybe I didn't do that enough. It's hard to say whether that's made a difference, but possibly it's caused a slight improvement. I'd read that dairy products can make things worse, so I tried cutting them out, but I wasn't convinced it made any difference. I've cut back on caffeine, though not much, actually. I also paid for extensive food allergy tests, but they didn't show anything major, so that's not an area my doctor thought was worth investigating further.
What medications have you tried?
Well, I took something called an antispasmodic,
Yep.
which my GP says helps to relax the muscular contractions which move food through the gut. But, to be honest, I don't think it made much difference in my case.
Have you taken anything else?
Well, I've been given antidepressants, and I'm giving them a go. I wasn't sure I completely understood the reasons.
Okay, well, a drug like that targets the signals being sent to and from the nerves in the digestive system. It has a calming effect on the muscles there.
Mm-hmm.
Do you find that this drug was effective?
Yes, I'd say it was on the whole.
Yes. So the next stage is script. The beautiful and wonderful part of your practice is going through the script and understanding what it is. Now, is that visible?
Yes, Father.
Yes,
Yeah, I'm
Yes,
not
Father.
putting it in a
Yes,
full
Father.
screen. I'm not posting it to full screen. You can see it, right?
Yes.
Without full
Yes,
screen.
Father.
Yes, Father.
Yeah. Now we will be listening to script learning. Maybe whoever asked that question, or if you have that question in mind, that shows you haven't attended my previous sessions, or you have not watched the previous videos. So these are not just YouTube videos. Just listening to those things will not help you. You have to look at the screen, write down the whole thing, write down the strategies, whatever is being explained, and work out the same material. Okay. And here we will be listening. In the script learning means we are practicing multitasking. Like you will be having the script of the audio in front of you as you have on the screen now. And you'll be listening to the audio. At the same time, you will be marking, underline the strategies, answers, whatever you want to highlight something. So you are multitasking, listening, reading the script, and writing. So that is the skill that you require in listening subtest. Okay, so let's do that now. Just listen to the, read the script along with the listening to the audio. As you listen to the audio, try to read the script at the same time. Try to write down something on your notebook, okay?
You hear a gastroenterologist talking to a patient called Andrew Taylor. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Taylor. Now, you've been referred to me because it's possible that you're suffering from irritable bowel syndrome or a related condition?
Yes, that's right.
Okay, could you start by giving me some background?
This has been going on for many years. After meals, I've always tended to get heartburn, but I found that pretty easy to deal with by taking antacids from the pharmacy. But a year ago, things suddenly got worse, and there were other problems I started to notice. The symptoms vary a lot, and they can be quite hard to describe exactly, but the main problem is bloating.
I see.
I need to tell you about some other things related to my stomach.
Mm-hmm.
Although this isn't something that happens every day, I've been suffering from constipation in the last month. In the past, I've had the opposite problem and would rush to the toilet several times a day.
Mm.
I just never know how I'm going to feel from one day to the next. It's the way the symptoms are so unpredictable that I hate.
Mm.
It's hard to plan my life.
Were there any other symptoms unrelated to your stomach and bowel?
Well, I have a skin condition that can flare up, and I know this could be related to irritable bowel syndrome.
Mm-hmm.
And the odd thing is that I often have migraines more or less at the same time as the stomach discomfort, and these can go on for days. It's strange, and I didn't at first think it was anything to do with my stomach problems.
Have you noticed anything that can intensify the symptoms in any way?
Well, I have a very demanding job as an accountant. I don't know whether this has a bearing on anything, but there's a chance I might lose my job in a reorganization of my department, so that's obviously something that's making me anxious. I don't know what's going to happen.
What's the worst effect the condition has on you?
The problem isn't just that it's nearly always on my mind unless there's some pretty big distraction, but also that it's so draining. What I mean is, I often feel that I've got no energy at all. I just want to sit around and do nothing when I get home from work, to be honest. I go to bed tired, but I'm frustrated because I have insomnia much more than I ever did before. I wouldn't say I've been suffering from depression, but a condition like this can make you feel rather down.
Right. And I understand that you've investigated the possibility that your diet's responsible for your condition. Can you tell me about this?
I was told by a nutritionist I saw that people with irritable bowel syndrome often don't eat enough fiber. In my case, I don't feel that's an issue. I've followed the nutritionist's advice about taking more fluids during the day, especially water, and accept that in the past maybe I didn't do that enough. It's hard to say whether that's made a difference, but possibly it's caused a slight improvement. I'd read that dairy products can make things worse, so I tried cutting them out, but I wasn't convinced it made any difference. I've cut back on caffeine, though not much, actually. I also paid for extensive food allergy tests, but they didn't show anything major, so that's not an area my doctor thought was worth investigating further.
What medications have you tried?
Well, I took something called an antispasmodic, which my GP says helps to relax the muscular contractions which move food through the gut. But to be honest, I don't think it made much difference in my case.
Have you taken anything else?
Well, I've been given antidepressants, and I'm giving them a go. I wasn't sure I completely understood the reasons.
Okay, well, a drug like that targets the signals being sent to and from the nerves in the digestive system. It has a calming effect on the muscles there. Do you find that this drug was effective?
Yes, I'd say it was on the whole.
Now you can maybe unmute some of you who want to respond. Could you just tell me something or something that you have highlighted here? What is the first clue? First clue about the topic?
Gastroenterologist.
That is in the context. Yeah, definitely. Then next one. Typically, what is the condition?
Irritable bowel syndrome. Irritable bowel syndrome.
Okay, good. I have highlighted it. Then what else? Next.
Some background.
Yeah, background. Yes. This is what you do every day, no? When they ask, you ask them about their background, what happened. Just there is an answer to what happened. Normally, in our colloquial language, we ask what happened, what was the problem. So they will explain exactly that is it. Yes. Then.
Many years.
Yeah, for many years.
After me.
Yeah. Always. What is always?
Scale.
Scale. Yeah. So that tells there is an answer immediately. Right? So for many years, the chronological expression followed by a scale leading to the answer. Okay. But I found that pretty easy to deal with by asking all those things. And pretty easy maybe when in your writing model, this goes against conciseness. Easy doesn't require a thing called pretty. So in a colloquial language, when you speak, you use pretty easy, but then in your writing, it will affect your cohesiveness or coherence in your paragraphs. So normally we avoid such expressions in your writing. Okay, then what else?
A year ago.
A year ago. Yeah, beautiful. Yes, that is great. See the chronological development for many years a year ago. Yeah. But what is a what?
Contrast.
Main problem.
What is main? What is the word main?
Adjective.
main, subsidiary, main, subsidiary, irrelevant, scale, main problem. The scale is there. It can be used as an adjective, different thing. But then immediately you have the answer, right? After a contrast and a scale, you have the answer. See? That's how you have to practice. Yeah, floating. Yes. Next. This is what is script learning is this. Somebody asked me now, what is script learning? This is how we learn script. Yes. This is what you have to do when you listen to. Okay. Now we are doing together to understand. Otherwise, this is what you have to circle, underline when you listen to. Yes. Some other things.
Some other things.
Is there a sequential expression? It's a sequential expression, right? Some other things. One more thing. Related to myself. Although this isn't something that happens every day, I have been suffering from
Constipation.
constipation. Was that an answer?
Yes, Father.
Yes. So one sequential followed by a sequential expression. Some other thing. What is that other thing is the answer. I have one more thing to tell you. For example, in your conversation, I tell Rajini, I have one more thing to tell you. I just forgot. Then that is important, right? You have to listen to what I'm going to say. For example, we are speaking and we are interacting. Maybe I visited your home and we are speaking about something, or over the phone, I'm discussing something. Then as we said, bye, okay, we'll stop. We are about to keep the phone. By the time I say, sorry, I have one more thing to tell you. That is important, right? That one more thing. So some other thing. That is called the sequential expression. Then you have the answer immediately after that. Anything else?
Every day.
Every day? Where is
Last month.
Yeah, every day. Here there is every day. Okay. Last month. In the last month, yeah. That is connected to constipation. You have to listen to emotions. In the initial sessions, I told you have to listen to emotions as well. Say unpredictable that I hate. Hate is my emotion, right?
Yes.
The speaker's emotion. So when somebody speaks about hate, about I love it, or I just love it, there will be an answer. I hate it, there will be an answer. When somebody expresses a lot of agony, there will be an answer. When somebody is so excited, happy, there will be an answer. So here hate, one answer. Any other? Any other symptoms? Any other symptoms? Again, one more thing. One more symptom. Do you have any other symptoms? Unrelated. Yeah, this is very, very important. They will speak related symptoms and unrelated symptoms together. You have to identify which is the unrelated symptom. There's a common tactics they use to trick you. Okay. Yeah. Now you see skin condition, and I know this could be related. He speaks about a condition. Skin condition
Could be related.
Could be related. We want only unrelated. So don't worry about the related, right? This could be related to irritable bowel syndrome. Related. This is related, so we don't take. And the odd thing is that I often have migraines. See, odd thing. Odd thing. And often. What is it? Scale. Yeah. And synonyms being used here often in the question frequent, everyday. All these are the synonymous expressions being used. So migraines is the answer. How beautiful you see? If you know the strategies, yes. Otherwise, I don't know. Without learning the strategies, I don't understand how the people appear for the exam. How do they get those scores? Even 250. I am not sure how do they get it. Yeah, less than the time. Okay, next. See, he speak about many things, but at the end he says it was anything to do with my stomach problems. Means it is not to do with
More or
what you call
less.
stomach problems.
Father.
Yeah.
There is scale more or less.
More or less at the same time as the stomach discomfort, and these can go on for days. Yeah, migraines more or less the same time. It's again speaking about more or less about migraines, right? It's concerned with migraines. So often you have more or less you have in between the answer is stopped and telling you this is the answer. From left and right, scales are pointing at it. Yes. See anything that can intensify the symptoms. Okay. Yeah, triggering factors. Yeah. Then, yeah, very demanding. Okay.
Demanding.
Again, it's a scale expression. Very demanding. It's not slightly demanding. It's highly demanding. It's less demanding. And another synonym used here is job work.
Job work.
Another
Father,
synonym
there
could
is-
be employment. Could be employment.
There is
Yeah.
an. We can find
exactly.
out.
Exactly. And means
It
in the
starts
gap you
from
can see
vowel.
before the gap you have an. So definitely the answer should start with vowel sound.
Vowel sounds.
Yeah. And vowel sound, there are many rules. For example, university, is it vowel sound?
No.
No.
It's not the
No.
letter, but the sound is important. University is
Account.
YOO. So university is a university, not an university. Though it starts with U, the sound is YOO, university. Yeah.
MRI.
Yeah, it can be a MRI, an MRI,
An
because
MRI.
EM,
An MRI.
an MRI because EM, M. But if you speak the full form of it, what is the full form of it? MRI?
Magnetic resonance.
Magnetic.
So is it an magnetic?
No.
No, it is a magnetic, but an
An
MRI.
magnetic.
But listen here, a magnetic and MRI. A member of the parliament and MP, because when you say short form, the contracted form MP, EM dot PI, MP. So a member of the parliament, whereas an MP. There's a difference. Maybe the same expression. For example, you can say an hotel, otherwise a hotel. Both the options are allowed because you can, H could be silent. A historical monument, an historical monument. When you make H silent, the other thing becomes an. So it's the sound that is important. An accountant is the answer, right? And every listening here, part A, you can see those job, occupations, professions, like job, work, occupation, that will be one answer everywhere. Okay, then next, what is obviously?
Something
Obviously, what is it?
urgently.
Yeah, obviously, doubtfully, uncertain, certain, all those things. Again, it's a scale expression, something that's making me anxious. Now, what is the worst effect? Worst, again a scale there.
Always, Father, there is scale.
But
Always.
yeah, always on my mind. It isn't. See, it is nearly. See, just that you have to understand. Even though there is a scale, the problem isn't just that it's nearly always on my mind. Means it's not in my mind. It's not always on my mind means it is not in my mind. So that always the scale is nullified, or the effect of the scale is nullified with the negative expression. The problem isn't just that it is nearly always on my mind. Means it is not in my mind always. Okay, unless there is some pretty big distraction. But contrast is there. As I said, when there is a contrast, what comes after contrast will be important. Normally the answer will be after the contrast, but also that is so draining. Is that the answer?
No.
Yes.
No.
Synonym of the answer. What was the answer?
No energy.
What I mean, I often feel that
Lack of energy.
yeah, no energy, lack of energy. But
No
this
energy.
is the see, but also that is so draining is lack of energy. What I mean is, what is the meaning of draining? I often feel that I have got no energy at all. So draining means no energy at all. What I mean is, what I mean tells you that I'm going to explain what I feel. So draining means what? I don't feel any energy. Draining means lack of energy. So no energy at all means lack of energy. So the answer is being repeated here. Draining and the synonym expression no energy at all, lack of energy. All these are same. Anything else? To be honest, I go to bed tired, but see, tired again, what does it say? No energy.
No.
Lack of energy. Okay. Yes. That's cool. Let's finish with the next part. Now, next one is We'll go a little faster because 12:30 I have a session. Diet is a side heading. No?
Yes, father.
Yes.
Can you tell me about this? So definitely a diet will be the answer.
Often.
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 Fiber. Enough
And
fiber.
enough scale, often scale.
Fiber.
Then the answer is fiber.
Fiber.
Go two scales, then immediately fiber. Then,
More fluids during.
yeah, hydration. It is the
Hydration.
word used in question center. Hydration, water. See, during the day, except maybe the nutritional advice about taking water, especially water. If that person may be enough. It's hard to say whether that's made a difference, but possibly it is caused a slight improvement. I read that dairy products. One more diet, right? Dairy products. Yeah.
And
The spelling,
First-
beware of the spelling. This is dairy. The other one is diary. D-I-A-R-Y. The book can make things worse. So I tried cutting them out. But
Okay.
that's why I said that some of them go to the exam and say exam was so easy. It was
Yes,
so easy. Instead of diary, they write diary. Then they believe that was correct. Then they say, definitely I have done well in the exam. And when the result comes, just try. Yes. But when you know these things, it will be very clear. That's why I said you should have time to just recheck the answers. But I wasn't convinced it made a difference. I have cut back on caffeine.
Often.
Okay. Yeah, I tried cutting them out. It's a synonymous expression in the answer. What was that? Sufficiently.
excluding.
Yeah. And water is sufficient, excluding. Yes. Caffeine is not. I also paid expensive food.
Paid.
Yeah. Paid for.
Food allergy test.
Also paid for expensive food allergy test. That's what I said. You have to listen to this particular audio 1 week. I said the 7th step I told you in Sapta Sutra, Sapta steps. I told you have to listen to one same audio. May not be one extract. The whole audio throughout the week at least. Okay. When you practice this particular audio or part A, you have to listen and do it at least 10 times. I tell you. Daily task, at least 10 times you have to listen to it. Once you listen and answer, and when the first you do it in exam conditions, you listen, then you check the key answers, then again you go to the script. Maybe if you want, you can read the script by yourself and mark the things. Then you listen to the audio and read the script and analyze and mark and underline and circle all those things. Then again go back to the audio without script and try to understand whether you understand those accents and all this. For example, here, food allergy test, they will say food allergy test. It looks like foodology, food allergy. So it sounds like foodology. So some things can be very strange for you, the accent. Okay. Then medications. Yeah. The questions clearly tell you next aspect. So even if you lose track somewhere, you can listen to the next question and immediately catch up. Okay. And
Antispasmodic.
so the antispasmodic, which GP say helps to relax the muscular contractions, move the gut. But to be honest, I don't think it made much a difference in my case. Means negative meaning is given. It was irrelevant. So answer will not be there when it is nullified with a negative expression. Have you taken anything else? See, anything else? One more thing. Come on, Nimi, I want to tell you one more thing. Anything else? And if you ask me anything else, yeah,
No,
one more thing. That will be important. Anything else? What is anything else? Antidepressants. That is the answer. Yes. Anything else? Yeah. When they ask anything else, something else, definitely the another thing, there is an answer. Okay.
Yes, father.
And see, this is the technique which you have to use for your speaking. Now you see, here he says, I wasn't sure I completely understood the reasons. He hasn't asked a question, but that English means is a presumption. There is a question. I wasn't sure I completely understood the reasons. If the your interlocutor makes a statement, you are supposed to answer that. Did you understand? Well, I have been given antidepressants and I am giving them a go. I wasn't sure I completely understood the reasons. If your interlocutor gives such an expression, then you have to explain what is antidepressant and why it is given. So, okay, well, then there will not be answers, okay? Here they are explaining. The gastroenterologist is explaining the whole, this part is gastroenterologist, the health professional speaking, and normally there will not be answer from the mouth of the health professional. Maybe exceptions could be possible, but 98% you don't have. So if they speak long, you can comfortably relax and dream for a while and enjoy the scene, okay? If the health professional speaks like this, no, very long, relax and dream, okay?
Thank you, Father.
Yes, welcome. And script analysis, what you have done, you can just have a glance at it. Same thing, chronological expressions, going on for many years. A year ago, last month, all three connected with an answer. You see, heartburn, bloating, a year ago, constipation, every day, last month. Now, next thing is scale, always heartburn. Main problem, bloating, main, bloating. And often, frequently, question says frequently, migraines. Every answer is connected to these strategies. You want to all these zigzags? See, beautifully written, scale, and the chronological expressions. Then you have most, recently here, okay? Most, frequent, often, every day, all those expressions. All these things we dealt with.
Thank you. Thank you so much, Father.
I had prepared the slide, but I thought let us do it together. That will be more effective. Yes, maybe 2 to 3 minutes. You want any slide to be revisited? Do you have any clarifications? Now, no clarifications. Now revisiting the slide. After that, I will come to the gallery mode. Then you can ask clarifications. This segment first, I will be taking the sessions. Next, if somebody wants to revisit a particular slide because you did not understand, if we will do that, then we'll go to the clarifications. Yes. Okay, cool. Let me stop sharing. Now you can ask one who asked just now. Yeah, please tell me.
Father, sometimes the word is singular and the answer is plural. That is more difficult.
No, if the word is singular, answer cannot be plural unless the context makes it plural.
Okay, thank you.
If the word is singular and if you write plural answer, that will be wrong.
Yes, Father.
Okay. So all those things, that's why I said you have to concentrate on the words before and after the gap. That will tell you, for example, an, after an or a, you cannot have plural. If there is a confusion, you can make out from the words before and after. Any other concerns?
Hello, Father.
Yeah, please.
How beautifully you step by step you taught. I never thought listening also can teach this way. Thank you, Father.
Welcome. You're most welcome. Yeah, but then what you have to do is you have to take up the same material. This is from official website. The second listening test, you have to take the same material. Don't look at the screenshots. Do by yourself now. Okay? By yourself. Just write down, maybe do the analysis. First listen and try to answer. Then do the analysis and do it. Repetition, no issue. There's a wrong notion, misconception taught to you from various corners that you should not do the same material again. That's only during mock test. The mock test last week, maybe when you have listening, you have 1, 2, 3, 4 weeks. 3 weeks you have to do revisit, and redo the test. In the 4th week, when you do mock test, you should not be doing the same material. That will not help you. Okay?
Father, listening improve ചെയ്യാൻ എന്തെങ്കിലും കേൾക്കാനായിട്ട്.
If you want, I can send you the best thing. You have video listening challenge in the platform. They are from medical journals. Listen to them and also try to summarize them. Listen to them and try to summarize in your own words what is being taught there. If there are some sequences, try to identify the sequences.
Excuse me,
and you can listen to anything. You can just search, or if you have BBC radio or TV news, but don't go in front of the TV. Listen from backside, or until your exam is over, turn the TV to the wall. Okay, screen of the TV to the wall and listen without looking at the screen. If you look at the screen, you will not be listening. You'll be understanding from the screen. Okay, or you put a curtain, put a black curtain to the screen, then you can understand. Okay, by the meantime, maybe a couple of I'll make one of a few announcements. Can I make? Okay. Maybe like, the Kata support group, I want to thank them. They are doing wonderful in their, what you call ministry, empowering others. Admin panel, definitely, I need not mention them. They are the backbones, and Kata support group is carrying on the discussion so well. We would like to have more volunteers, and definitely that will help them a lot. That's I'm telling you from the experience. It's not just supporting others, but the clarity they gain in the smaller group discussions, and when they present, when they teach, maybe teaching once is equal to learning 25 times. So they get that clarity about the strategies, and they will definitely go into the videos of the previous sessions with that scrutinizing mind, and that will fix in their mind, that will build up confidence as well as competence. So we would like to have more volunteers try to join. It's not volunteering, it's actually the deeper learning. And also, if you can mind, maybe today I'll try to publish one. Lizzie has made a small video about our EduSkills platform. You can also make and try to introduce the EduSkills, make a small video. Maybe I said you can take any of my previous sessions and convert it, explain it in your own language. You see, I find it very hard to present the things in Malayalam. So you are a Malayali, what you have understood, I can send you even the slides if you want the original slides, or you can use the screenshots. Try to explain so that it will be really beneficial for you. At the same time, it will be beneficial for thousands of people. Maybe some of our videos by student fact when they were students here, now they are abroad. They have 7,000-8,000 of views, which means so many people have viewed it and benefited from it. So that's a great service you can do to the society. And if you are introducing the platform, always you say it is of the OET aspirants, by the OET aspirants, for the OET aspirants. It's our platform. And also, what is unique about it? Emphasize non-profit. Thousands of now I can just check and tell you what is the status of my WhatsApp message. Okay, it is 1,747 from today morning. 1,747 chats I have to answer, and a good deal of them asking, Father, what is the package? What is the cost of your training? I have to answer everybody. No payments, absolutely free training. So for which you can just paste it and publish it, and you can tell them so that I can do some meaningful work. Otherwise, those people will feel Father is not bothering about my. Then they repeatedly send messages. Then they scold me for no reasons. Father is not responding. Okay. Maybe somebody, if he is poor, there are people who have sent, maybe because I am poor, you are not responding. How do I know the person who has sent is poor or rich? And there are people who really scold me. I take it in a very light sense. I don't mind. But why should we make them to do all those nasty things, negative thoughts, and maybe allow them to commit sins? So try that way. And non-profit platform, they may not understand. You'll have to say no fees. Okay, no payments. And about the strategies, mentor, style of functioning of the platform, you can speak about admin panel, and just give them an idea. It's your platform, our platform. All of us do it. And also tell them there are recently I started to put in the description, in the description of every video, I have started to paste the links of previous Zoom sessions, because many are requesting me on WhatsApp. So make them aware. The links of previous Zoom sessions, all the sessions are available in the description of every video, and also the link for the platform. And thousands of them request a Telegram link to me personally. For looking at the YouTube video, there is a number, then they will post it. But if you go to the description, you need not request me. They can immediately click and go and verify if the link is not working. Sometimes I need to change it again. And also you can make them aware about liking, sharing, commenting, bell icon, all those things, so that we reach out to many people. And try to post, when you go to the comment space, YouTube comment space, try to just click the like buttons, not only the video, of every feedback. If somebody has given a good feedback, give them one word. Congratulations, thank you for your feedback. If there is a response mode message icon, you can click and respond to them. Or at least click the like button for everything. Just go on touching it. That's great. That will improve the reach of the video, and many will receive. Many will be benefited. And also try to paste the Telegram link. You know the Telegram group, how to take it, no? Go and press the EduSkills International, that button. Then you find add members, there is link. You can copy the link, and when you visit the YouTube channel, copy that and keep on your tip of the finger. Okay? The links, maybe the whole links or the Telegram link, something should be in your finger. Just click and paste, that's all. it will definitely relieve me. That will be the greatest help you can do me so that I can take more sessions. Reply to the collect the names of those. Also, I told you there are ways if you can collect. Kata support group is there. Even others can collect the names of the people who have posted their comments. That's how we give preferential admissions, and we categorize them into different. One is pinned messages. Whenever there is a good, all I will not be able to pin. Okay, whenever I come across some good feedback, I pin it so that everybody can read it. Then one category is pinned message. Other one is comprehensive analysis. The other one is summary analysis. Other one is what you call pseudo, like supporting statements, like thank you, excellent, all those things. Okay, 4 or 5 categories. And in the main platform, it's not only the admins and the what you call Kata support or empowering army. Anybody, you can just console somebody and encourage somebody who is crying over there. I am a beginner. I don't know what to do. Just tell them it's cool. Don't worry. Try watching the videos. Write down the strategies. Try to practice. Slow down. You can. Tell them one word. Or if they ask for batch code, if you know the batch code, don't put in the platform. But personally in their Telegram chat, you just send it to them. Answer their queries. Support them. Even if you don't know the answer, tell them, okay, Father will respond to you. Admin panel will respond to you. We are taking note of your concerns. Yeah, just a second, which can help and support many people. Answer and console. And ultimately, I told you, add at least one person every day. At least one person every day. That's how you came to this platform, So add at least one person every day so that we reach out to maximum people. Okay, ultimately ask yourself what I have done for my platform, our platform. What have you done? What have I done for my platform? And I will be happy if you post what you have done. Answer to this question to me in my WhatsApp. Okay, when I see only those, what is the fees, what is the link, what is the speaking, give me speaking partner, at least I can come across some messages saying that I have done something for the platform. I'll be so happy about it. You can post me that. Some consolation when we are going with hectic schedules. Okay, otherwise all the messages are selfish messages. They want something. Right? Thousands of messages. I have to cater to their needs. But I want to see that you support the platform, not supporting me. Always I tell you, it is EduSkills, your family. Be a volunteer, just spend 10 minutes a day. Let me know or the admin panels, just 10 minutes. That's not just serving. Definitely serving will help you. Definitely you will build up confidence. That will be great learning for you. And God will reward you as well.
Sure, Father, I will try to do.
You have to message to me or admins, anyone. We will put you in smaller groups and we'll help you. Yes.
Father, could you please send this link and today the YouTube?
Which one?
Today's class section from the beginning.
No, may not be, because we had a lot of distractions. It will take at least 6 to 8 hours for editing. But today I'm traveling somewhere in the afternoon.
Okay,
it was a sudden decision. I thought next 2-3 days I'll be going to the university. And I'll be posting it whenever I get time. Immediately I'll not be able to do it.
Because I'm a little bit late joining, Father. That's what. Sorry for no problem.
Okay. No problem. You can watch the other videos and this an advanced video. By then I'll try to upload. Okay.
Sure.
It will take time because soon after this I have a meeting. Then I have to travel. Yeah. Then next 3 days I'll be in the university. Cool.
No issues, Father.
Yeah. And now we are requesting for more volunteers because many of our strong volunteers have passed their exams and they have gone abroad. Now, like they are busy with their OSCE and all. Now they'll not be able to support. That's why we are requesting your support to carry on continue the platform. And I'll be posting Lizzie Raphael's one small video. Probably if I get time, I'll post it today or tomorrow. And definitely you can watch that. And similar to that, or take any part of the portion or the test, subtest, anything you can make a video. That will be great learning for you. As Winnie said, she really realized only after making a video. I could not publish it because that was in the initial stage. It was dark without light and audibility was less. But she made a video with that. She just blotted up and she was so much confident and her learning process was. And many have shared that experience. That was part of video challenge, was part of our platform that always helps you to build up confidence.
Father, Father, I'm Milka. Father, I'm Milka.
Yes,
I want to
please.
speak with Father.
Yeah,
Father,
please.
Yes, Father, today watch this video. No, it's very useful for me because before that I'm just going listening and answer that. But now I get the Saturday how to do this listening. But Father, one thing I have difficulty in writing, Father, because I cannot complete within 15 days. 15 minutes, sorry, Father, 15 minutes, I cannot complete the whole 20 questions. I'm not getting answer how to write, Father. If I can get
that's what I said. You can never, not only you, no one can. In the initial stage, you cannot, for example, if you are learning driving, you cannot drive in the first or second day in 60 or 80 kilometer speed. You have to go 10 kilometer speed. It will take time. Only by practice, you will defeat time. Only by practice, you will defeat time. No other technique for that. As you practice, go on. Don't worry about time and score in the beginning stage. Don't worry at all. Your score can be 0. No issues. You have to build up the confidence. Score is not important. Time is not important. That's why I said you have to. We are doing just part A, listening part A for 1 week.
Yes, Father.
Does it make any sense if you are thinking about the time?
Yes,
How much
Father.
time did I take now? I took so long now to analyze one extract from our part A. 7 minutes business. I took more than 2 hours. Maybe when I upload this video, I tell you that will take minimum of 15 hours from me. Now session, nearly 2 hours, more than 2 hours. Editing some 8 hours, 10 hours. Then preparing for the session, making slides and all those things. That will take another 3-4 hours. So it's not easy. So don't worry about the time factor. When I spend 15 hours on one extract of our listening part A, you should at least spend 10 hours, right?
Yes.
Thank
you are supposed to spend 30 hours, but at least 10 hours.
Yes, Father. Thank you, Father.
Father, I tried for your reading part C for the fact and opinion. Really, it's worked out for me. I tried many questions before, Father. Just I'm just go for the blind man, how to throw the mango with the blind man. Before I thought like that, all the answer, but the fact and opinion I realized and I try to apply. It should be worked out. Thank you, Father.
Definitely, gradually, and take time, slow down, have patience. This will help you not only in listening or reading. When you practice one module subtest, it helps all other subtests because you are enhancing your competency, English competency. That helps in your reading, listening, writing, speaking. Don't worry that you are practicing one module or one subtest.
Actually, the question also asking the fact, but before me attending, I'm not realizing what is fact, what is opinion. Just I'm thinking the fact is something they're asking something more about. But now I realize what is fact, what do you mean?
Sometimes I get a little fed up because even today there were so many questions asking that could you take a session on cause and effect. See, I have highlighted, put in the thumbnail, cause and effect, and I have taken session and uploaded, did not attend the session, did not consent about watching the video. So how can I answer these questions? Unnecessary questions.
Because just go through that video and try to at least one paragraph and try that all the synonyms, fact and opinion. Everything is there.
Yeah.
I
tell you, this is not just learning for OET, learning for life. And yesterday somebody called up and said, Father, not even OET itself is not enough. You have to train the candidates in English. Don't train only in OET, because she says recently, this week she has gone to UK. She says, I don't understand anything what they are speaking. She's struggling there. So build up the competency. Otherwise, how are you going to, for example, when I take up the sessions, I go so slow. Even this is not enough. You have to
Father, I tried to study 2 institute, but nobody mentioned about any competency, any strategies. They will get, okay, you roll out for the 2 answer, especially for the part C. The 2 answer, it will come with one answer, it not mentioning anything in the paragraph. The second answer, it come for the opposite. But I am choosing where is the opposite answer, where is the without coming. Then I am choosing the 1 and 2, 1, 2, 3, 1, 2, 3 like that. I'm go for the correct answer. Even I'm blinking also, it will not get the correct answer. But actually, you are the one only told this is the strategies, this is the things there is. Really, I'm appreciate, Father.
Yes, and you need God's blessings, I tell you. Definitely, you need God's blessings to pass OET. 50% your efforts. And one of the ways to receive God's blessings, as you pray, at the same time, communicate to others, reach out to others. Because there are so many who are really struggling. So many who are really disappointed. There are so many who send me messages. I can't share all the messages. sending me audios and long messages telling that I was really fed up. I didn't know what to do. I had given up OET, but when somebody added me to your group and I looked into it, and from there my life changed. Maybe an adding.
God will bless you more and
Yeah.
all the. Thank you.
You can simply add at least 4 or 5 people to this group, not to increase the number. We don't gain anything by that. I'll have more work. But then we reach out to maximum people who are really deserving. Especially, there are so many people who are financially struggling after Corona, who have lost their jobs in Gulf.
Really.
So please help, add people, and see that see Kata support people. A couple of them are adding people and making every week they are adding 1,000 people. The admins and Kata support people adding 1,000 members in the platform. You are seeing the celebration, right? 1,000 members, they celebrate 20,000, 20,000, 20,000. A couple of admins and couple of Kata support group are doing that. And they have to spend hours and hours together. If you can just add 5 people, they need not spend their lot of time here. They can support you in the platform. Whichever you can do, definitely you should be doing it, right? So I appreciate if you can send the message that I have so many people in the main platform and support the platform, and let everybody be supported. And on 9th, if somebody is interested to enter online, I don't know, the CVDP program is a 1-day full live session will be there for the beginners. We have some clarifications and all that. It will be a live session. I hope it will be on Facebook or YouTube. Otherwise, you'll be able to attend live. And if you want to share your experience, we'll give you a chance. It's a big organization here supporting poor health professionals. One of the biggest organizations in the state of Karnataka, NGO, yes. If there are some people other than Kerala, just text me, okay? Your state and your name today.
Yes, Father. Actually, in that your platform, I have one doubt that doing assignment. I didn't understand that doing assignment.
Assignment, everyday task is being posted soon after the discussion. Everyday task is being posted, and weekly task is posted in the application if you want to take a printout.
Okay.
For example, this week we are posting task A, listening, question booklet, script, and audio. And we have explained the 7-step method, how to practice it. If you have not seen, go to the video. Okay. Video listening day 1, day 2, day 3, day 4, day 5, day 6. Unless you go through those 6 videos, there is no meaning in my teaching anything, because it has taken, those videos have taken hundreds of hours from me for editing, because listening is very challenging to edit. You have to cut the videos, convert it. Most of the time that will not go with the format, and all those things are there, and all the distractions, and the normal systems don't support the editing software and the audios. Now you see, as I was trying to present audio in the PPT, it was getting overloaded. Yeah, that's what you have to download.
Thank you, Father.
You have to take that task every day soon after the discussion, evening discussion, 8:30 to 9:30, before 10 o'clock, within an hour, maybe within 30 minutes after the discussion, they will post daily task, what is to be done for tomorrow. Okay. And guidelines will be given. Related videos also, links also will be shared there. Watch the videos, do the task as per the instructions, and submit it in the application or to the mail oetskills@gmail.com. Okay, or you can submit even in the main platform if no other option is.
Father,
Don't worry, your confusions will be over. You can ask these questions in the platform, and anybody who knows the answers, please answer the concerns of other people. Okay, I don't want to. You should not be making me to answer those things. Going to the platform, doing that, so that I can train you more. Save that time for me. Yeah.
Father, you are posting in the Rainy application, that app, or where is posting this all the assignment and all?
Assignments is posted in the batch, particular batch which is running now. It is also posted in the main platform, Telegram platform. So if you are not able to access in the application, you can find it in the main Telegram group, or if you can't find in the main Telegram group, you can find in the assignment segment of application.
Okay.
Yeah.
Okay. Thank you, Father.
Okay, welcome. I think we will conclude. Any other serious concerns? And also try to give your feedback in the main platform, so that those who, like, the house was full, always the session is full. Those who could not attend will be able to have an idea, learn from your feedback. Then when they watch the video, they will understand better. And
Father,
whatever
I'm Shandy.
Yeah, whatever the feedback you give in the main platform, copy it and keep in your WhatsApp folder, in your folder, so that when the video is published, you need not again type. You can just copy and paste it over there so that it will be helping thousands of people. Yes. Yeah. Shandy Joseph, yes.
Yes, sir. His father, I'm Shandy. Actually, I am a beginner.
Yeah.
Actually, I have some confusion about OET. That is
definitely.
why today morning I sent you.
Yeah, definitely. You should have confusions and doubts. These are the genesis or beginning or starting point of every wisdom. Only when you have doubts and confusions, you will learn. Okay.
Father, actually, no any evening session or late evening session is there. So
yeah.
Like
Our session time. Our session timings are normally 10 o'clock, 10:30 in the morning, 5 o'clock in the evening, and 8:30 in the evening. If there are sessions, it varies, depending on days. For example, today I have afternoon, I have to travel somewhere, so morning I have taken. Yes.
Because general duty time for me, and that is why I cannot attend.
Schedule will be posted. Schedule will be posted in the main platform. That's why I said if you have a doubt like that, whether there is a session today, you just ask in the main platform. Let others. I want you to answer to others. When somebody else asks, where is the session? When is the session? And all those things.
Actually, no, sir. How can I enter the main platform? And nobody entered me. I think.
You must be a member of the Telegram group, EduSkills Telegram group. No.
Yes, actually Telegram group I can get it, but no, I am not sure I am the.
That is the main group.
Of.
That is the main Telegram group. If you can see the discussion, daily discussion and all, you are in the main group.
Okay.
Cool. Yes. Yeah.
Father, those who are staying outside Kerala but they are Keralites need to message you.
No need. Those who are not born Malayalis, non-Malayalis can message me. Yes.
Okay. Father, here we can message.
You can just text me in the WhatsApp.
Okay.
Okay. Just type first non-Mallu. Just type first non-Mallu, then continue. Okay, so that easily I can identify without reading whole thing. There are so many messages coming in. So first write non-Mallu. Yeah, start your messages non-Mallu, so and so from there. Yes. Introduce yourself. Yes. Yeah,
okay.
Cool. Where is our Lily Mole? Congratulations. Maybe Lily Mole. Is she there?
He left the platform and
okay. Cool. Yeah. Convey our congratulations, Lily Mole. Recently scored high and passed the OET. Yes. And get back and video challenge. I want all of you to get into the video challenge. Okay, that's a part of your learning and building confidence and supporting our family.
Thank you, Father.
Yeah.
Thank you, Father.
God bless you.
God bless you.
God bless you.
Thank you
Bye-bye.
very much, Father.
Yeah. God bless you. Yes.
Thank you.
Cool. God bless you. Bye-bye.